Hey everyone, and welcome to the Balanced Bodies Blueprint. I am your host, Vinny Russo.
And I'm your co-host, Dr. Erin Stansfield.
And we're shifting gears from all the conventional fitness narrative you hear on most fitness podcasts, as our main emphasis lies in preventative healthcare, adopting a holistic approach to nutrition, and challenging the traditional views on various fitness topics.
Our mission with this podcast is to provide you with the information you need to achieve optimal health.
In today's podcast, we have the pleasure of bringing Hormones Demystified back on our podcast for round number 2. It's pretty cool because our first episode with you, which is currently our most downloaded episode to date, it really shed light on the quackery that's associated with functional and integrative medicine. And in this episode, we are discussing probably the most misconstrued topic when it comes to overall health and weight loss, which is the thyroid and thyroid testing. But before we dive into this, I just, in case anybody missed our first round together, which was episode 11, if you can just give them a brief introduction of who you are and what your current mission is.
Sure. I'm an endocrinologist, been one for about 20 years. And the mission that I had, so I have a blog, and the mission that I had with that blog was basically to give people a place to find the information that you just can't find elsewhere on the internet. So essentially, it was patients coming to me with all the sort of bizarre things that their naturopaths and other alt med providers had recommended that they do. And that people were looking for answers to this information. You know, are these legitimate lab tests that I had ordered? Because I have like 10 pages of labs here that my alt med doc ordered, and they told me I should take all of these supplements. You know, are these a good idea? And if you look on, at least at the time that I started the blog in 2017, if you looked on the internet for answers to a lot of these questions, the mainstream medical sites would just tell you sort of the standard, this is what you're supposed to do, but they would never really explain why all the other crazy stuff that the quacks were telling you was wrong. So that's what I decided to do, was just to kind of do some research into where are they getting this information? You know, why do they counsel people to do this stuff? And then I was breaking it down and just trying to show people exactly why I was wrong.
Yeah.
And the blog is still up. And that's actually how I found you, is having to answer a lot of patients' questions and how, you know, to support. I knew the data for the medical side and what the medical societies recommend, but how do I, you know, undercut or cut down the argument against me with the functional medicine providers. And so it was very helpful to have an explanation and say, all right, this is why this is wrong. And you explain it so well in that blog. So I highly encourage anyone who's listening to this to please check it out if you're curious. And there's references in there as well, and anecdotal experience as well.
Yeah. And I remember the first time she started reading your blog, she told me, she's like, we got to have him on the podcast. And when she started telling me some of the stuff, I was like, man, I definitely heard this before. And then you were on the Docs Who Live podcast. That's where I initially heard you. But it was so cool how she was saying all this stuff. And I was like, I definitely heard that somewhere. And it was just like a meeting of two worlds. And it's pretty cool because, you agreed to do not only our first episode, but our second episode. So we're really excited to get this episode going about thyroid health.
Well, thanks, guys. I'm glad you found my blog in an obscure corner of the internet. It's awesome.
All right, so let's just start with the basics here. So for all our audience, you know, that are listening, they might not know the symptoms of hypothyroidism, basically. So can you tell me who should go be seen by a physician who might suspect themselves of having hypothyroidism? What are the symptoms? That sort of thing.
Yeah, that I find that question so difficult to answer when it should be really easy to answer, because there's the classic symptoms: weight gain, constipation, feeling very cold, having fatigue and mental fog, dry skin, change in periods, all that kind of stuff. And then there's real life, which is people come in with just a constellation of different findings. So I usually would tell people, you know, if you feel generally unwell and it's not normal for you and there's nothing obvious going on, it's a pretty decent idea to see your doc to get some basic labs. And usually one of those basic labs is going to be the thyroid screening. But, as you know, I think there have been at least a couple of epidemiologic studies where they look to see how many symptoms of hypothyroidism do totally healthy people have who don't have a thyroid problem? And it's usually at least like 3 or 4, because you ask anybody on any given day, hey, you tired? Oh yeah, I'm tired.
Yeah.
Yeah.
I could have gotten more sleep last night. Hey, how's your mood? I don't know, I'm a little depressed. And and then you go on from there. And most of these people are not going to turn out to have a thyroid problem. So
Correct. I
that's
think it's
something
just a generalized symptoms, right? It's just
yeah.
not very non-specific, if you will. I always say if there's a change from baseline in the past few months that, hasn't gone away. But yeah, I experienced the same thing on my end where it's, at what point do we just say, all right, we'll just get the blood test? And on that note, what kind of blood testing would you recommend if somebody were to be curious about their thyroid?
So for the vast majority of people, and I know that what I'm about to say is going to conflict with what people have read on the internet on less reputable sites than my own, I would say just get a TSH. And if the TSH is very normal, and we can talk about what very normal means, it's highly unlikely that you have a thyroid problem. So TSH is thyroid stimulating hormone, and that's the hormone that the pituitary gland in the brain makes to tell the thyroid to make thyroid hormone. And the reason why TSH is such an awesome screening test is that it changes by a lot for very small changes in people's thyroid hormone levels. So if you look at kind of the normal range for the thyroid hormone level itself, which I'm just going to abbreviate as T4, that's the common way we check the thyroid hormone level. So if you look at the normal range for T4, everybody likes to keep their T4 in a very, very tightly regulated portion of that normal range. So if their thyroid hormone level drops even a little bit within the normal range, but it's not normal for their body, the TSH is going to respond by shooting up a lot. And that makes it a very, very sensitive screen. And that's why I'm telling people, hey, listen, you really, for the most part, we can talk about the caveats, but for the most part, you just need a TSH. And if it looks good, then you are most likely good. But again, we can talk more about the subtleties of what makes a totally stone cold normal TSH.
So is it safe to say that TSH is the most reliable test to diagnose hypothyroidism?
Yeah, if we're talking about the most common form of hypothyroidism, which is called primary hypothyroidism, which is where the thyroid just isn't working right, then yes, it's without a doubt really hardly any qualifications to make. It's going to be the most useful sensitive test.
Yeah, well, I had an incident and she was looking at my blood work, what was it, 2 years ago with my TSH. So my thyroid levels were a little bit low, but my TSH was really low. And I'm like, what's going on here? And she was like, I don't want to scare you, but you might have a growth on your pituitary. Like you got to go get checked out, right?
Well, no, it was more than that. Like the clinical picture was more than just the TSH.
I'm abbreviating
it. All right, Benny, let's let Dr. Aaron tell the story. Okay?
Yeah, please.
It was still normal. I think I was more concerned about the other hormone markers, but he had some symptoms that were consistent. So we digress off the thyroid stuff, but yeah, that wasn't that his clinical picture wasn't as straightforward as that. But I will ask this question. So TSH being sensitive and likely specific for somebody who might be hypothyroid, would you get a T3 and a T4 or just a T4? And can you explain why?
Sure. So if the TSH is, let's just say, mildly elevated, indicating that the person may have mild hypothyroidism, because remember the TSH moves in the opposite direction of the thyroid hormone levels. So if the thyroid hormone level is dropping, TSH is rising. So let's say TSH mildly elevated, I would check a T4 also called a free T4. So let's just say T4 is what we mean. We mean free T4 when we say that. I would check that, and if the T4 is obviously a bit low, then usually you've got your answer there. But most likely, if the TSH is only mild to moderately elevated, the T4 is just going to be somewhere in the lower third of the normal range. And that's just telling me that the likely situation here is that person usually likes to keep their T4 higher in the normal range, and it dropped. And that's not normal for them. So that's why the TSH went up so much. And that right there will usually make the diagnosis depending on how obvious the clinical picture is. I'm usually not going to get a T3 level. And I've written a lot about this because there's just a ton of stuff out there, but to just sort of to give the very short basic intro version, the T3 levels just in the blood, they don't correlate very well with what's happening at the tissue level. So the body is just really great at defending T3 levels. T3 is the active form of thyroid hormone that's getting inside the cells and getting the job done, doing what thyroid hormone is supposed to do. But you can't get all the information that you need about what the true thyroid hormone levels are from a T3 level, because there's just too much variability at the tissue level.
See.
Compared to what you're checking in the blood. So for hypothyroidism specifically, trying to diagnose it by checking the T3 level just isn't going to be that helpful, because usually what happens is the T3 levels in the blood are either normal or they're very slightly low, but that's in everybody. Like normal people with no thyroid problem and people with hypothyroidism, you get the same results. So it just doesn't help that much. There is another test that's sometimes helpful to clarify things, which we're probably going to talk about at some point, looking at antibodies. But if we're just sort of doing the intro, talking about TSH, T4, T3, what's helpful for screening for hypothyroidism, it's going to be TSH and free T4.
All right. Well, and I'm going to just jump in here because I know that a lot of functional health coaches and practitioners, they love to order reverse T3, and they love to talk about how it's extremely important. And I could be wrong with this, but I thought it was only important if like you're in a comatose state. I could be completely off though there too. So can you speak to why someone might get reverse T3 and if it's even important or not?
Yeah, reverse T3, it's the marker of whether you're being taken care of by an alt med doc or a regular mainstream
That's a
doc,
good way to
really.
put it.
It's not a useful test at all. And again, this was one that when I wrote a post about this one, which was called Everything You Never Needed to Know About Reverse T3, I was actually really curious to see like, where does AltMed get all this stuff from? Because I had no idea. Because all they tell you in your training is, yeah, reverse T3 is basically to try to tease out, just like you said, Vinny, when someone's in the ICU and they're super sick, and somebody for whatever reason decides to check some thyroid numbers and they come back looking funky, and you're not sure if they have a thyroid problem or this is just a derangement of the thyroid numbers due to critical illness, which happens. It's something called non-thyroidal illness syndrome. But it basically just means the thyroid function tests look funky and it's because you're really sick for some other reason. So if you check a reverse T3 in that scenario, it can give you some useful information because it's high in critical illness. But for people who are walking around as normal outpatients, it just doesn't help at all. And I can tell you a couple reasons why people get it if you want to dive into that a little bit more.
We can. So my experience with this is looking at some of our clientele, our patients, is that some of them might be bodybuilder bikini competitors, for example. And I think when they go to, at least anecdotally, what I see is when they go to a functional medicine provider, they're like, you're starving. And so now, because we're going to check this reverse T3 and prove that your body needs some kind of thyroid support, right? And
depressing.
and so I think it's like they've taken the critically ill patient that normal mainstream medicine would likely get a reverse T3 on, and said, and put this kind of persona on the bikini competitor and said, you're critically ill, and now we need to get this level to prove that. Yeah, so can you tell us a little bit more about that, and maybe some caveats that go along with that?
Hmm. Well, that's interesting. I wonder now, I'm kind of wondering what that person who's, doing the bodybuilding competition, what they're actually doing that might cause the derangement. Like if they're doing something really extreme with diet at that point,
Yeah,
they're trying to cut
exactly.
weight or yeah.
Yeah.
Um, so yeah, that's kind of interesting. I don't know so much about checking your reverse T3 in that instance. I can sort of just tell all the other reasons why it's not helpful. But I will say that when people are eating ketogenic diets, and I think when they're fasting as well, what we often will see if somebody decides to check thyroid numbers, this is in people who are otherwise healthy, the T3 levels, not the reverse T3, but the T3 levels can be frankly low.
Right.
And that triggered a concern among some people that there might be a thyroid problem, but it doesn't seem to be indicative of a thyroid problem at all because the TSH is, pretty much always normal in those people and they don't have any symptoms. So they're basically just having a funky number, which is not fully understood. I don't know if there's something that's different about the metabolism of certain nutrients that just requires different levels of T3 in the body. I would really just be guessing at this point.
Mhm.
But as far as the reverse T3, what I can say about it, while I don't know why it would be abnormal exactly in the person who's competing, unless, again, it's one of those funny dietary
Well, it's
things.
funny because you get it and it's usually normal, but
Oh, is
the functional provider will
oh,
say, "Oh, you have a problem." But
oh,
I think
okay.
that's the rationale that they use. Like, oh, you must be critically ill because you've been dieting for so long, or you have like a low body fat percentage, which I
Hmm,
think is an interesting play, right? But I really don't think that these people, these are essentially very healthy people with low body fat percentages. So
hmm.
usually it comes back at a normal range. But then again, the functional provider will order it. And I was always told during my training, you don't order a test unless you do something with that information and you know what to do with the information. So I think that
Yeah,
that's part of the issue.
Yeah, face it all.
yeah,
so,
yeah, for
so
sure.
yeah, so maybe you can explain to us a little bit more about reverse T3.
Yeah. So, there's a lot of claims about it. I would say one of them is that elevated reverse T3, if it's present, it prevents T3, the active form of thyroid hormone, from binding to receptors. And the claim is that if that happens, it's going to cause hypothyroidism at the tissue level, at the cellular level. And looking into this, it turns out that reverse T3 actually doesn't bind to thyroid hormone receptors and it doesn't even get inside the nucleus. So, and there's actually evidence that shows that it just doesn't do that. So that claim really can't be true. And I've been unable to find any evidence that it does get into cells and it does that. There's also a claim that elevated reverse T3 decreases the metabolic rate by decreasing the conversion of T4 to T3. And the studies that AltMed has cited on that don't actually support that statement. And I've explained it in detail in the post. It will make people's ears bleed if I go into it here, so I won't do that. But let's just say that it doesn't decrease the metabolic rate either. And then there's this idea that if you're giving someone levothyroxine, and which is the most common form of thyroid hormone replacement that we give, and the reverse T3 is elevated, there's a claim that that means that just giving levothyroxine alone without giving some other form of thyroid hormone, like giving T3, the claim is that that's going to be ineffective. But that also doesn't really make any sense because when you give more levothyroxine, as you're increasing the dose, you're always driving more conversion of that levothyroxine to T3. So having an elevated reverse T3, if it is elevated for some reason, doesn't affect that process. You increase the dose of T4 hormone, the levothyroxine, you're going to drive more conversion to T3.
Yeah, it's going to change the feedback loop a little bit as well.
Yeah.
Can you talk about, so, you kind of spoke about T4 and T3, but can you talk about why, because I feel like every alt med provider orders a T3 level and then they make clinical decisions based on that specific level. Can you talk about what the caveat there is with using that level?
Is this in people who are taking some kind of thyroid replacement or people who aren't, or either way?
Either way, but let's start with people who aren't.
So if they're checking a T3 level in people who aren't, and they're making a diagnosis of hypothyroidism based off that, it's not valid mainly because there are so many normal people. And when I say normal, I just mean not a thyroid level. That they don't have a thyroid problem, yet you check their T3 level and it's slightly low.
Yeah.
And that's just it's kind of a funny thing about the testing for T3. And again, it doesn't tell you what's going on in the person's cells because the local tissues are actually converting T4 to T3 there. Not all tissues. Some of the tissues need to rely on the T3 that's made in other parts of the body that gets secreted into the blood and they pull it out of the blood as it makes its way around. But quite a lot of tissues in the body are making their own T3, and you just can't measure that because they're making the amount of T3 that they need at any given time. And if they don't need that much, they won't make that much. If they need more, they'll make more. And unfortunately, we just have no way of measuring that. So in people who are not on thyroid hormone and their T3 level in the blood is slightly low, but all the other tests are normal, TSH and free T4, well, the low T3 doesn't really mean anything to me. And there's really no way to sort of get around the fact that it just doesn't mean anything. I've seen, pretty much all kinds of alt med nonsense with that, that they just sort of because I think we talked about this last time that they have a hammer and they really want to hit that nail
Yeah.
and that, they don't have really a very deep fund of knowledge to draw from. So it's just like, oh, please let me shotgun enough labs. And if there's something that looks even the slightest bit funky, we're going to go ahead and jump on that and treat it. But it just doesn't mean that. But it is a different story when we're talking about people who are on thyroid hormone because it starts to get more complicated, especially if we're talking about alt med providers, since they're usually, not always, but they're often using a form of thyroid replacement that includes a lot of T3 in it.
Yes.
And it's not a very long half-life hormone, which means that you're getting some very different levels throughout the day in the blood, depending on when you draw that blood test in relation to a dose. So when you check T3 levels in people who are taking T3, they're probably even less useful to tell you all that much. If you really want to, you can check it when you think the drug is peaking just to see what the peak level is. And you can check, at its trough just to see what the trough is. But I don't know that it really gives you a lot of actionable information.
What is the half-life of T3?
It's about a day.
Okay. So it has a fairly short half-life.
Yeah. Yeah. I mean, if we're comparing it to T4, which is about 7 days,
Yeah.
and T3 circulating T3 in the blood about 1 day or less. So by the way, reverse T3 I think is like 4 hours. So it makes it even less useful because you're getting a blood test that has a short
Which is why
half-life
you
and
get it in the
all over.
ICU, right? Because you're getting labs every few hours in the ICU. So that makes
Yeah.
more sense.
Yeah.
Can Can you talk about, speaking of the alt med providers, I see a lot of, treating what they think is hypothyroidism with pig thyroid or, other forms of thyroid hormone. Can you touch on that and touch on like what the difference is with actually going to an endocrinologist and what they would treat you with and why?
Sure. So, pig thyroid or desiccated thyroid, that was the standard of care for a long time. That's all we had until like the 1970s or so, when the levothyroxine took over. And the reason why most mainstream docs are going to like levothyroxine is because it is identical, chemically speaking, to thyroxine that the thyroid makes. So um, thyroxine was the T4 we were talking about before, and that's what the thyroid makes. Levothyroxine looks just like that. So it's essentially a very natural, if you want to use the term bioidentical, we could, form of thyroid hormone. And it's got a pretty long half-life. So it's pretty steady state in the blood, and it's nice because you've got this pool of T4 that the different tissues can pull from, and they can take whatever they need and make T3 from that. So that tends to work pretty well for the majority of people. Um, but there's a very sizable minority of people for whom that isn't perfect. They have beautiful looking numbers on paper, but yet they still don't feel quite right. And that's a really hard situation because we talked about the fact earlier that thyroid symptoms are often pretty non-specific. So if you have someone with hypothyroidism on levothyroxine with beautiful looking thyroid numbers, but they don't feel great, what does that mean? Does it mean that there's something else going on, like sleep apnea, or who knows what else it could be? But it could be many things. Or does it mean that their thyroid regimen's not optimized yet? And it could be that the thyroid regimen's not optimized yet. So that's where this idea of T3 comes in, because some people really do respond to T3. In the endocrinology world, I will say, while there are some endocrinologists who may use pig thyroid, um, it's not quite as common, I don't think, as maybe adding in a little bit of T3 hormones separately. So you basically have the levothyroxine, which is the main thing you're given, and then you've got a little dose of T3 that you give on the side. And the reason why we do it that way is because we're trying to mimic the body's normal ratio of T4 to T3. So the body usually has somewhere in the neighborhood of about a 15 or 20-to-1 ratio of T4 to T3. So when we're giving levothyroxine and liothyronine is the T3. When we're given that, we're trying to keep the ratio somewhere between like 10, 20 to 1 so that it mimics normal physiology as best as we can. And when you look at pig thyroid, the ratio of T4 to T3 is 4 to 1, which means that it's got way more T3 in there. So why is that not good? It's not great because it's not physiologic, but it's also this huge bolus of a very short-acting hormone. And anytime you give a very short-acting hormone, it has the potential to act more as a stimulant than a replacement therapy. So the sort of the danger there is that some people will just feel too jazzed up, and not in a good way, from that, because they're like, well, I feel really jittery in the few hours after I take my pig thyroid. Or on the other hand, some people will feel really, really good after it. And then, we'll say that, over the course of several months or so, the general good feeling that they have may start to wear off because they were actually getting perhaps more of a response to the stimulant effect of the big dose of T3 in the pig thyroid, as opposed to actually having their underlying problem treated adequately. So what you wind up with is this chasing of the high, so to speak. And I know a lot of people object to that phraseology, but it's just a convenient way to think about it, because it really does. Anytime you give a hormone that you don't need, testosterone or, hydrocortisone or T3 or whatever, if you don't really need it, it can be a stimulant and it can feel pretty good and tends to act like a stimulant drug. But if you take meth, you never say that you're correcting your methamphetamine deficiency. I mean, it doesn't make any sense. So anyway, pig thyroid, while it can be helpful for some people, um, it doesn't really make a lot of sense physiologically because the ratio of T4 to T3 in pigs is just not the same as the ratio of T4 to T3 in humans. So
So really quick before we move on from that topic, but I see a lot of like thyroid support supplements that
hmm.
have something that says like bovine thyroid in it. So can you explain to people who don't know what that is, what it is, and if it can have any um, potential effects on those people taking it?
Yeah, any one of those supplements that's labeled as a thyroid support, if it has anything other than just a bunch of herbs you've never heard of, then it's probably not good. So that bovine thyroid extract is essentially cow thyroid, and it's usually something similar to the more prescription grade pig thyroid, just at a lower amount typically.
Mhm.
But it can still, if you take enough of it, it can still cause all the same effects that a prescription strength drug would cause. And that's not really a great idea because instead of supporting your own thyroid, and I'm just going to assume that the person taking this is normal, meaning doesn't have a thyroid problem because they've been diagnosed
Exactly.
by an alt med doc, which means they almost certainly don't have a thyroid problem. So they were told then, oh, well, you should probably just take this thyroid support formula. But anytime you take something that you don't really need, it shuts down your body's ability to make it by itself. Because remember, it's all in a feedback loop. So
Mhm.
the pituitary is monitoring what the thyroid hormone levels are doing at all times. And if it sees this bovine thyroid, pituitary is just going to say, awesome, I don't need to make that much thyroid stimulating hormone. There's already plenty of thyroid hormone around. And you can wind up putting the pituitary to sleep if you take enough of that stuff. And it won't make so much TSH, which means the thyroid will go to sleep. And then the real major downside is once you stop that stuff, it sometimes takes quite a while for everything to wake up. So you feel like crap during that process. Same thing as like bodybuilders who have taken a ton of testosterone and then just stop it right off the bat. They often feel pretty bad.
Yeah. So the other thing going along with that theme is I see a lot of functional providers saying you have subclinical um, thyroid issues, and then treating that with a pig thyroid or some other kind of thyroid supplementation. Can you speak to what the issue is with diagnosing somebody with subclinical thyroidism and then also treating that? What are the potential downfalls for the patient if it is treated, and if you are diagnosed by a functional provider, which I would never recommend with subclinical thyroidism.
Is that even a thing too? Does subclinical even exist? What does
Yeah,
that mean?
it is a thing for sure. So subclinical hypothyroidism is going to be defined as usually a mild elevation of TSH with a normal free T4. That's just it's basically a biochemical definition. It kind of implies when we say subclinical that there's no symptoms, but that's not really the case because usually the reason why somebody's getting tested is because they have symptoms. So it is just a biochemical diagnosis. Slightly elevated TSH, but normal free T4. Um, so in that setting, there's really usually if I feel like I'm seeing that person and the story is pretty good for hypothyroidism, I will usually go ahead and repeat those tests, and I'll add on a third test, which I alluded to earlier. That's called TPO antibodies or thyroperoxidase antibodies. There's a lot of antibodies that can be checked for the thyroid. If you've been to alt med, you've probably had at least 3 or 4 of them checked. But when we're looking at hypothyroidism, the only one that's really useful is this TPO antibody test. And the reason why it's useful is that the most common cause of hypothyroidism is the immune system attacking the thyroid, and that's called Hashimoto's. So the antibodies that attack the thyroid can be measured in the blood. That's the TPO antibodies. So if I see someone with those subclinically hypothyroid tests and I'm trying to make the case that this person should be treated, I will typically check the TPO antibodies because if they're positive, it really lends more credibility to the idea that, oh, okay, you know what, they're probably brewing something here, and their symptoms that they have may very well be due to very mild thyroid dysfunction at this point. So I should treat them, and I will treat them with usually levothyroxine and kind of go from there. But if the TPO antibodies are negative, then it doesn't mean it's impossible that they could have real hypothyroidism brewing. It just means it's less likely, particularly when the TSH is very mildly elevated and the T4 is pretty darn normal, comfortably within the normal range. And they have maybe some other things that could be going on. I usually would talk to them and say, hey, you told me that you snore at night and you wake up feeling terrible and, foggy and headache and dry mouth. Maybe we should get a sleep study and see if you have sleep apnea before we stick you on thyroid hormone for the rest of your life. Because if people have negative antibodies and you recheck those thyroid function tests over the course of 3, 6 months, a year, they will often normalize on their own.
Right.
Because people sometimes just have mildly abnormal blood tests.
Right.
You check blood tests enough times, you get abnormal numbers. So not a great idea to just jump right on thyroid hormone without doing a little bit of additional workup, because usually then that means that you're committing to taking that forever.
Right. Right. And can you talk about, people that do go on thyroid supplementation? Can you talk about the physiology of that? Because you mentioned that's kind of a lifelong decision typically. I mean, obviously you're going to get labs and make sure the labs are consistent with, being adequately treated. But can you talk about that? What happens if you don't really need thyroid hormone and you're placed on it? What are the problems with that?
The biggest problem is that people will, if they respond to it, which they sometimes will because it's a hormone that they don't really need, and sometimes it'll give you that stimulant effect, they'll get in this loop of every few months as the placebo, sorry, not the placebo effect, the stimulant effect. Sometimes there is a placebo effect, but that also wears off after 3 to 6 months. But if there's a stimulant effect at all, it wears off. And then usually the dose gets increased, particularly if we're talking about alt med. And if that cycle goes on and on and on, then usually people wind up getting quite sick because they're by that point, they'll often have thyroid hormone levels in the blood that are quite high. And we'll see some numbers that are disturbing. The TSH will be quite suppressed, and T4, maybe T3 will be elevated. But more concerning is they'll have, very fast heart rate, potentially having atrial fibrillation, which is not a great heart rhythm to be in. They'll have, if it goes on for long enough, they can have loss of bone density, they can have loss of muscle tissue, um, and they can have poor sleep. And there's a whole host of things, mood changes, anxiety. It just goes on and on. I mean, if you look up the symptoms of hyperthyroidism, they're not great. So being thyrotoxic from too much exogenous thyroid hormone that you're taking is just a bad physiologic situation
Right.
to be in.
Right.
So with sorry, that's our dog howling right now. So if we're talking about people that are interested in optimizing their thyroid, right? We see these supplements that say thyroid support, and they don't have, maybe they do have the herbs that we can't name or pronounce. Maybe they have the bovine hormone and they're like, I don't want to do this now after watching or listening to this episode. How would you suggest they optimize their thyroid through diet and lifestyle choices and etc.?
Um, so optimizing through diet and lifestyle becomes maybe a little bit more important when people have some kind of reason why they can be deficient in certain um, things. Like, for example, if they have inflammatory bowel disease of some sort, they have Crohn's disease, or they've had a gastric bypass, they have some reason to malabsorb certain nutrients,
Mhm.
certain vitamins, certain minerals that are important when it comes to thyroid function. Then it maybe becomes important to look at checking a few levels of a few things here and there, and maybe taking normal, like multivitamin type doses of these things, not mega doses usually. But for the most part, most people are not walking around in a state where I'm worried that they're deficient in something. I do see people taking these mega doses of iodine or selenium, or name it. There's several minerals and trace elements that people take mega doses of, and it's usually not a bad idea. I mean, not necessarily. It's usually not a good idea, because um, they're going to wind up with other problems. If you take too much selenium, I think there was one study that showed an increased risk of, it may have been developing type 2 diabetes. If you take too much iodine, you can actually suppress thyroid function, at least temporarily. It's kind of a paradoxical effect of taking megadoses of iodine. So, these things are usually just not a great idea. So people always want to, I get the impulse that people want to be proactive and do something, but they really should just be eating healthily. So if they have some sort of restrictive diet, I don't mean to pick on vegans, but it is a fairly restrictive diet. They're at risk for B12 deficiency and iron deficiency, and I would probably want to make sure those people are taking supplements. Anyone who's of childbearing age and is a woman, usually a good idea to be taking prenatal that has the normal amount of iodine in there, which is, I think, somewhere in the neighborhood of about 200 micrograms a day or something like that. So that's just kind of the normal stuff that I would recommend. But pretty much the thyroid is good at taking care of itself.
Yeah, because I'm under the impression, especially with a lot of people today, it's like they look for a reason to blame their weight gain on, or their inability to lose weight. And a lot of that is blaming the thyroid. So they're like, I want to optimize it no matter what. And in their mind, there's something wrong with it, whether labs show it or not, whether their clinician says you're fine or not, they still believe there's something wrong. But your advice is really just, hey, like, have a well-balanced diet and your thyroid will do its thing.
Yeah, I know it's totally unsatisfying
Yeah.
because once
It's not
people,
sexy at all. Not
it is
sexy at all.
not sexy. Yeah, no one's ever accused me of being sexy. So yeah, I totally get it though. I mean, especially once people have read enough about this stuff, it because you can find a recommendation for pretty much anything that you decide you want to do. If you get really interested in B vitamins, I'm sure you can find a reference on the internet that's going to tell you should be taking a B complex that's a megadose for thyroid support. It's probably there somewhere. But no, I don't think any of these things really have great evidence, except for those rare instances of malabsorption, like a zinc, for example, another one. If you have really bad malabsorption after a gastric bypass, or you've got really bad Crohn's disease, yeah, okay, maybe you have a reason to malabsorb zinc and you should check a zinc level, but the average person should not be checking a zinc level.
And not even to mention like the interactions that can happen between minerals. Like if you overdose on one, could really affect the absorption of another.
Sure.
So yeah, I think that's important for people to know.
Yeah.
So, what would you tell, or what advice would you give as an endocrinologist to somebody who might be seeing an alt med provider for their thyroid issue, if they have one?
It's like you're holding it up on a tee and you're telling me to just knock it. That's,
Have fun with
oh
this one.
God.
Do
Run
do a little
away.
happy, yeah, do a little Happy Gilmore run up to it and just
Yeah.
knock it out of the park, please.
Oh God. I remember the first time I saw that movie, I never laughed so hard. Um, yeah. So, I mean, if someone's seeing an alt med provider, to try to be somewhat fair about this, I know I really bash on them a lot because I've had just so many horrible experiences with them in real life and seeing what they recommend on the internet. But I have occasionally run across an alt med provider who's fairly reasonable. I'm sure there are more things we disagree about than agree about, but I've seen what they do, and it's not totally bizarre. So what I guess what I would say is, number one, the competence of your alt med provider is inversely proportional to the number of blood tests that they order for you.
I like that equation.
So if you have 7 pages of lab tests, then your doctor is probably a quack. It's like the "you might be a redneck" routine with Jeff Foxworthy, your doctor might be a quack. And then, if they're giving you some form of levothyroxine, brand names like Synthroid, Levoxyl, or generic levothyroxine, all fine. And they may be adding in a little touch of liothyronine with that. I think that's quite reasonable, and they're using the TSH to guide replacement, plus using your symptoms and physical exam. I don't want to ignore that at all. A lot of people complain that mainstream doctors only look at blood tests and we ignore everything else. It really is important to
Yes.
to look at people, examine people. I mean, just as quick example, if I see somebody who's got delayed deep tendon reflex, delayed relaxation phase of the deep tendon reflex at the ankle, for example, or the biceps, those are the two most useful places I find. Sometimes that means they're not getting enough thyroid hormone. So that's just one physical exam find we might look for. But I would say that if they are giving you a medicine that's compounded for the thyroid, it's usually not a good sign. Compounding pharmacies, we talk about that in a whole separate episode. It's a crazy business.
Round 3 coming up.
Yeah, it's not something that I like. And if they're giving pig thyroid, there are a reasonable number of mainstream docs who like to give pig thyroid. So I don't think that makes it make any more sense, but I'm just going to say that there's a lot of crossover, I think, between mainstream medicine and alternative medicine when it comes to thyroid. Just some pig thyroid, some people give it. In fairness, I will say that there's at least a couple trials out there that were reasonably well conducted clinical trials showing that even though at the end of the trials, all the arms, each arm, levothyroxine alone versus levothyroxine plus liothyronine versus pig thyroid, they all pretty much had the same symptom scores by the end of these trials. So no clinical difference could be detected in how they were really feeling on any of these meds. But then when you ask people, which one did you prefer? And they were blinded to their treatment. They will often say they prefer pig thyroid or levothyroxine plus liothyronine and not levothyroxine alone. So in fairness, there's a role there somewhere for T3, but if you look at, it's maybe getting too dense, but if you look at subgroups in those trials, at least the last trial I'm thinking about from a couple of years ago, the group that actually responded and said they liked the T4 plus T3 medicine or the pig thyroid better, those were the people who were on levothyroxine alone and didn't feel optimized on levothyroxine alone. And that is exactly what I've seen in clinical practice. So I don't think it's crazy to give a little bit of T3. I don't like giving it in the form of pig thyroid because it's so non-physiologic. But if people are really insistent on taking it, it's not the worst thing in the world if they're at least not being massively over replaced.
Right. I've only seen like as far as like the endocrine society say that the T3 treatment is useful in people who've had total thyroidectomies, because it seems like those people have a lot more symptoms and they seem to benefit from having a little bit of that T3 replacement. And
100%.
so it's interesting that that other people are benefiting as well. That's what I've read as far as actual data goes, and
Yeah, no,
recommendation.
actually, I think the thyroidectomized people are the most likely. So if I'm looking at somebody who might need T3 and they have no thyroid, immediately my threshold is sort of lower for
Right.
starting them on some T3. And I think
T3.
it's probably because, the even though the thyroid makes mostly T4, it does make a little bit of T3,
Right.
probably about 5 micrograms a day or so. And when you have no thyroid, obviously you're not making any T3 from your thyroid. You're just relying on peripheral conversion of T4 to T3. So I think there's a good reason why thyroidectomized people may be the ones who respond the most to giving some T3. But if you have someone with primary hypothyroidism or someone who's had radioiodine treatment for hyperthyroidism who has had complete destruction of their thyroid tissue, not that you can really measure that, but let's just say they have, those people might also respond. And then there's just everyone else who may respond, but they may not be responding for the right reasons. Meaning, I've always thought that there should be a sort of category of pig thyroid responsive malaise, like it's a diagnosis that we would give people because they don't actually have hypothyroidism, but yet
Right.
they feel better on pig
Right.
thyroid. So that to me, that's pig
stimulant
thyroid
I was just
responsive
going to say, it's
malaise.
probably the stimulant
It's
effect
just
of
the
it, the high of
stimulant.
that.
Yeah.
Yeah,
It's,
it may
That's
be.
why,
adding
that's why I drink
caffeine.
coffee in the morning.
Yeah, I was just gonna say it's like adding caffeine with a little bit more serious consequence.
Well, look, we're getting down to the time limit here. I know you're a busy man. Um, Dr. Aaron, do you have any more questions for HT?
I mean, we could go on and on this topic. I love it. But thank you for your time. No, I think I think you've explained it well for our audience members and given great recommendations.
Yeah, of course. And so HT, we really appreciate your time. We thank you coming back on again. We touched a little bit about compounding pharmacies. I know that's a pain point with Dr. Aaron as well. So that's round 3 coming up. So in the future, we're going to do that. But thank you so much for your time. Can you just do us a favor and just let people know where to read your blog and if they have questions to get in touch with you?
Yeah, you can find my blog at hormonesdemystified.com, all one word. And my email address is on there if you want to send me a note. I don't answer personal medical questions, but if you just have a general question or you wanted to share something with me, you can definitely just shoot me an email.
Awesome. Oh, well, once again, thank you so much for your time. And round 3 is coming up soon. So get prepared.
Hey, it's always a pleasure to talk to you guys.
Thank you
Awesome.
so much.
So on behalf of Balanced Bodies, we just want to say thank you for joining us on this episode of the Balanced Bodies Blueprint.
We are committed to bringing valuable content. And if you enjoyed today's episode, we'd greatly appreciate it if you can take a moment and like it and leave a 5-star review.
On Apple, just go to the show, scroll down to the bottom and rate it there. If you're on Spotify, go to the show's page, click the 3 dots, and you can rate it there as well.
And if you believe in the power of knowledge, share this episode on your social media to try and get the information out there to as many people as possible.
And as you navigate your own path towards better health, remember that Balanced Bodies is forever in your corner. See you all next week.
The podcast content may include discussions of medical topics and health-related information. However, the information provided should not be considered exhaustive or complete, and it should not be relied upon as a substitute for professional medical advice or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition or treatment.